Quite often when I am in a get together, people ask me, what do you do for a living? And I tell them I am a preventive oncologist. Primarily what I mean to say is that I am a doctor who specializes in preventing cancer. And I like looking at their expression when they say, what do you mean, can cancer be prevented? I said, yes, of course it can be prevented. Not all cancers are though, but many cancers can actually be prevented. And as we go about talking, how does one prevent cancer, and also what can be done to actually make sure that those which cannot be prevented are diagnosed as early as possible. You might remember this recent cover page on India Today, in which they talked about that there is going to be a rising tide of cancers in India. One can only go to any of the major cancer hospitals of the country to see the teeming crowds and how difficult it is for the doctors to cure those people who are coming in advanced cases. And this number unfortunately has dramatically increased as in the last few years. I am sure there is hardly anybody here who does not know some individual either in their family, in their friend circle or in the neighborhood who has not suffered from cancer. When we talk about the magnitude of the problem in this country, there are roughly 14.5 lakh people. Unfortunately, roughly half of them, that is 7.5 lakhs, do not survive. As of today, 1 in every 8 men and 1 in 9 females will die of cancer in their lifetime. The interesting part is that 40% of these cancers are tobacco related and roughly 20% are related to some infection or the other. And both these things, that is tobacco as well as infections, are by and large preventable. However, the not so good news is that more than 2/3 of cancers which present to us in this country are in the advanced stages and they are difficult to treat. To talk about various geographic and organ specific prevalence of cancers, India is a huge country and it is but natural. It has a large variety of organs which are affected by cancer. And there is a geographical differences between the various cancers. For example, in the northeast of the country, the cancers of the gallbladder as well as the throat and esophagus are far more common. At the same time, if you go to the south, to Kerala or to coastal Karnataka, one finds that thyroid is the most common cancer that one can see. While in the north, you find cancers of the oral cavity, the gallbladder and the esophageal part of the body is actually far more affected. At the same time, one sees that because of these geographical differences, are there any factors which are common between them, and that is the area of research. When we compare the age related incidence of cancers from various population based cancer registries, one finds that, for example, in females, the breast cancer and the cervical cancer are the highest prevalent. Most of these cancers are much more in the northeast. For example, Aswal has a very high incidence and the lowest incidence is in Barshi in Maharashtra. There is a difference of roughly 5 to 6 times in the prevalence of these cancers, and this is a unique phenomena to India. When one talks about breast cancer, the maximum prevalence of breast cancer is in the larger cities, for example, in Bangalore or in Bombay or in Delhi. On the other hand, if one talks about Barshi, it is a very small number. To sum it up, the International Agency for Research on Cancer, which is a WHO body, confirms that the maximum cancers of the females are in the breast and cervix, and for the oral cavity and lungs in males. The unfortunate fact is that if one were to model what is going to happen 15 years or 20 years from today, there is a clear cut evidence, as can be seen by this diagram, that the cancers will probably go up by at least 10 to 15% over the next 20 years. And this data has been collected from various cancer registries around the world. I know this is a rather gloomy picture, but as they say, desperate diseases require desperate remedies. So, what is the way forward? Can something be done about this or not? If I were to put my money on what is the best buy and what will give me the maximum bang for the buck, my suggestion would be put it in prevention, awareness and early diagnosis. These are the only three things which will work in the long run. What do I mean by this? The single most preventable cause of cancer, as you well know, is tobacco. Tobacco, or the big T as they call it, is consumed by 35%, that is nearly 1/3 of the country's population. The numbers are staggering. More than 165 million people use smokeless tobacco, that is pan masala, zarda, khaini and so on and so forth. 69 million use cigarettes and another 42 million have a mixed use, that is they use both smoking and smokeless tobacco. And these numbers, I am sure you would agree, are rather daunting. Tobacco unfortunately is responsible for many diseases, including various cancers of the head and neck, of the lung, the stomach, colon as well as the bladder. In addition, tobacco also causes various cardiac, respiratory, oral as well as diseases which affect many parts of the body. And interestingly, it also causes reduced fertility in males. That is one area one has to be careful about. Thus, it is obvious that tobacco is one of the biggest enemies at the present moment, and also it is something that we can do a lot about. There is a lot of movement to restrict the use of tobacco, but a lot remains to be done. Roughly 45% of all cancers in men and 15% in females are attributable to tobacco. And more than 80% of all cancers of the oral cavity are due to tobacco. In addition, as I mentioned, it affects various other parts of the body, both in terms of heart disease, chest diseases. It also causes stroke and blindness. Thus, what are the other things that are preventable? As you know, I talked about 20% are due to infections. So, as far as prevention, can we prevent these infections? I am not sure how many of you know that there are vaccines against cancer. Hepatitis B vaccine, that is a kind of vaccine for jaundice, is widely available for the last many years, and it was the first vaccine against cancer. India, unfortunately, is the second highest number of people infected with hepatitis B. Thus, the hepatitis B vaccine over the next 15 to 20 years is definitely going to reduce the number of liver cancers in this country. Similarly, of late I am sure you have heard about another virus which is known as human papilloma virus, which is responsible for cervical or female genital cancer. This vaccine is available for the last 10 years and at the moment available in the private setup, but there are a lot of moves for the government to introduce it as part of their universal immunization program. And this particular virus causes more than 99% of cervical cancers. In various countries which have taken this vaccine early, for example, in Australia, already in the last 10 years, the number of potentially malignant lesions of the cervical cavity has gone down by 50%. Other known risk factors of cancer, which I am sure you are familiar, just to remind you, include alcohol, radiation, reproductive factors, occupational exposure to various pollutants and to gases, and at the same time obesity and unhealthy diets definitely is responsible for a variety of cancers. Roughly 10% of all cancers are familial, that is, they are in the family. If a lady has a breast cancer or an ovarian cancer in the family, for example, or a sister or a mother, her chances of getting this particular cancer are much more. So, these individuals have to be doubly careful and have to be screened appropriately. So, these are something that you can prevent cancer, but there are many things which you cannot do a lot about, but one has to be careful. At the same time, people ask me whether microwaves or cell phones cause cancer. Well, to the best of my experience and the present knowledge, there is no evidence to support these particular theories that cell phones or microwaves are causing cancers. It is an old saying, a stitch in time saves 9. If you were to ask me what would be the single best alternative for India, it would be, in addition to awareness, you should be going for early diagnosis. Early diagnosis, given the appropriate cultural milieu and appropriate cost, is something that is highly achievable. In an ideal scenario, more than 80% of individuals should be aware of symptoms of cancer. Same number should receive timely diagnosis, and 80% should also have access to treatment when a disease is diagnosed, and ideally less than 90 days from the onset of the symptoms. Having said that, it is still early days, and I am sure these goals are achievable, but will take some time. In order to achieve early diagnosis, our institute, that is National Institute of Cancer Prevention and Research in the National Capital Region, and I am sure other cancer hospitals and medical colleges run regular screening camps, as you can see, and also have a health promotion clinic where a lot of information is given to individuals, as well as appropriate investigations are set up which are low cost and which are also feasible in our country. It is also important that the patients who are diagnosed with early disorders are treated and followed up appropriately. So, why should cancer be a priority for a country like India? It is expected in another 2 decades there will be a change in the shape of the age pyramid. At the moment, more than 65% of our individuals are less than 35 years of age. However, with better life expectancy, this is going to change very, very rapidly, as it has changed in most developing and developed worlds. Lifestyle has already changed over the last many years and probably will change much more in the decades to come. Thus, we still have at the present moment a relatively high mortality in spite of a low incidence in this country. However, there is a caveat. This low incidence may also be not 100%, we may be talking about underreporting due to lack of awareness and lack of diagnostic facilities. At the moment, there are huge differences in numbers of cancers vis-a-vis other developed countries. For example, it is nearly 1/4 of the incidence as in the US of A, and nearly 1/3 of cancers prevalent in China. The focal areas for cancer research in India have been mainly towards the more common cancers like oral cancer or cervical cancer, but as the number of cancers increase over the board, one will find that more and more emphasis is given to research on not only early diagnosis, but also treatment for these cancers. It has been suggested that we could use both practitioners of modern medicine as well as Indian traditional medicine, so that these doctors can help and also be a part of our screening strategy in this country. There should be an emphasis on good quality epidemiological and clinical studies in this country, as well as it is expected that the National Cancer Registry Program as well as the National Cancer Care Program, which has now been amalgamated with non-communicable diseases, spreads widely over many districts. I know the challenges are many and resources are relatively few, but to address this, there is a national cancer grid that has been formed under the aegis of Department of Atomic Energy, which has brought under its wings more than 85 cancer centers, both in the private as well as the public setup. And the idea is for them to combine forces, not only in sharing best practices, also doing combined research as well as practicing the best in preventive and therapeutic cancer care. In an attempt to increase the awareness and improve the information that is available to the general public, a website has been launched, and this contains some of the very recent India specific information both for diagnosis, prevention and treatment facilities available in this country. To address the fact that how do we go about diagnosing cancers early, a meeting was held in Delhi about 2 years ago of all major experts from around the country and outside the country too, and that had resulted in a policy document which was released last year. In addition to the concerted attempts of the Ministry of Health and various other cancer centers, in March of 2016, Prime Minister Modi released a statement that he would like a framework of cancer control to be formed in the next 6 months or so. And interestingly, on the 29th of August 2016, we were glad to see that the operational guidelines for containing the framework and all the nitty-gritty details of how to go about diagnosing and managing common cancers in India was released. And this is being taken up by various states as part of their National Health Mission program, and we are very hopeful that many of these states will start an organized plan as far as early detection is concerned. You might also have seen a lot of hype, not only in this country but around the world, about targeted therapy for cancer, how the more recent ways of treatment are actually improving the cure rates for various cancers. Whether it is hype or hope, I feel there is a lot of hype, but a lot of new rays of hope are also coming out, and we are very sure as time goes by, the number of cancers hopefully at least may not increase in the way they were hoping that they will, or they were scared that they will, and cancer, instead of being a deadly disease, will become a chronic disease. I leave you with this particular slide, and the sentiment there is hope. Please be part of our journey, of our crusade, not only to prevent cancer, please help us in diagnosing it early. Thank you so much.